Hello everyone, my name is Yujia and I interview a nursing coordinator at community hospice in the industry of life care. I interviewed a nursing coordinator who works at a community hospice that supports patients who diagnosed is terminal. This patient can be living in a long-term fallacies or at home. Rarely, they are still under the care of hospital. Families are expected to take on most of the care of the patient in hospice, with team of doctor, nurses, social workers, and champions there for support. Hospice workers receive extensive in-house training in order to deal with the specific challenges of caring patients at end of life. A hospice care nursing coordinator has the responsibility of numbers of patients. The coordinator conducts admission and the intake for new patients. She must also visit her stable patients once a week in order to check that they are receiving proper care and to answer any question the family might have. A hospice nurse must be on call in case of the patient death, because it is her responsibility to pronounce the patient dead. Call the corners, dispose of the medication properly, and provide emotional support for the family. The interviewee motivation comes from her preference for working with people. She has a lot of empathy for people at a specific time of their lives. She enjoys teaching the families to how to care for the patient and enjoy her personal interactions with the patients and the family. The major challenge is dealing with the stress and the grief of death. She emphasized that hospice nurse might have dealing with more than one death per day. She credited the hospice infrastructure for providing the support to deal with this unique stressor. According to the interview, her position required a bachelor in nursing. With this degree, she was able to become a team leader. She did not have specific training in hospice care before. She applied to the position. This is common. So the hospice provided her with extensive training. She places a lot of value on this training and believes that the training helped her to become much more effective. She believes she was hired as a hospice nurse due to her skill list with people and her ability to teach. As a coordinator, she remembers the transition from the paper to the computer and how difficult this was for many of her co-workers. She has seen a lot of change in medical technology, but not that many changes in act of nursing. Nursing is still deeply personal relationship. She relies on her required training and on her in-house hospice training to keep updates. Since her qualifications, she requires taking course every 2 years. She chooses course that is related to her field. Principally, hospice employers are looking for people who can handle the stress of supporting patients at the end of life. They want someone who is compassionate and a good teacher. Of course, they would prefer people with previous experience in hospice, but they are willing to train. She advised is to finish your education and then reach out to the hospice employer. If you believe you have necessary qualities, She used the certification proceed to provide her resources, and she heard good things about book Nothing to Fear by Julie McFinn.